Hello everybody, and welcome to PathoLogic. Today we're going to be discussing the pathophysiology of diarrhea. Diarrhea refers to a relative excess of water in the feces in proportion to the dry matter content. Usually this results from increased fecal water, but it could potentially result from reduced dry matter as well. The loss of solutes and water in diarrhea results in significant body disturbances, including electrolyte depletion, acid-base imbalances, and dehydration. To understand diarrhea, we will first look at the intestine's normal fluid balance. Under normal circumstances, the ingesta itself contains a substantial amount of fluid from the animal drinking or from the water content of the feed itself. This fluid content is further increased by gastric, pancreatic, biliary, and enteric secretions that enter the small intestine. There is also passive movement of water out of the intestinal circulation to attempt to try and balance out the osmotic effect of the nutrients within the intestinal lumen. To try and absorb this water, the enterocytes pump sodium chloride from the intestinal lumen into their cytoplasm. Because sodium chloride is highly osmotic, water follows that new concentration gradient and enters the cells and the body's circulation. Any remaining fluid leaving the small intestine gets absorbed by the large colon. With that background, we will first look at small bowel diarrhea. Small bowel diarrhea refers to a problem within the small intestine that causes excess fluid to enter the large intestine. This overwhelms the large intestine's capacity to reabsorb that fluid. Clinically, we see this as infrequent passage of large amounts of fluid feces. There are three basic mechanisms behind small bowel diarrhea that we think of, but in practice, these mechanisms overlap significantly and are not very distinct. These mechanisms are secretory, malabsorptive, and effusive diarrhea. We will start with secretory diarrhea. This type of diarrhea results from excess secretion of water in comparison with intestinal fluid absorption capacity. It is commonly associated with bacterial enterotoxins, but it can also occur due to inflammation, tumors, and other disorders. In these other conditions, cytokines or hormones are directly or indirectly stimulating water secretion, thus leading to diarrhea. So in secretory diarrhea, we see some sort of toxin or hormone change shutting down the co-transporters in the enterocytes that absorb sodium chloride. This prevents water absorption in the small intestine. At the same time, those hormones or other triggers activate chloride secretion channels. This leads to increased chloride entering the intestinal lumen. Water in the body's circulation follows the chloride concentration gradient, releasing water into the lumen and leading to diarrhea. Malabsorptive diarrhea results from villus atrophy, which is often associated with viral disease. The villi are the main mechanism that enterocytes have in order to increase their surface area, which helps maximize their water and nutrient absorption capacity. This means that when villi atrophy due to disease, water and nutrients remain within the intestinal lumen. So here we have an enterocyte with atrophied villi. Because of this atrophy, the cell's ability to absorb water and nutrients from the intestinal lumen is diminished. Water then leaves circulation as it follows the osmotic gradient produced by the nutrients that are remaining in the lumen. This increases intestinal fluid content, resulting in diarrhea. Finally, we have effusive diarrhea. This results from increased permeability of the intestinal vasculature, which allows more fluid to leak out of the enterocytes than normal. This increases water within the intestinal lumen. Potential causes of effusive diarrhea include elevated hydrostatic pressure in the vasculature, such as from heart failure, decreased plasma oncotic pressure, such as from protein-losing enteropathy, or inflammatory disease causing increased capillary permeability. So in this type of diarrhea, the underlying problem in the vasculature increases the water available within the intracellular space. Water then leaks into the intestinal lumen, increasing the lumen's fluid content and causing diarrhea. Next, we will look at large bowel diarrhea. Large bowel diarrhea refers to a problem within the large intestine that causes reduced water absorption. Clinically, we see this as frequent passage of small amounts of fluid feces. That feces may have associated mucus or blood within it. Usually, large bowel diarrhea results from some sort of microflora imbalance due to fatty acids, bile, or carbohydrates entering the large intestine after they are poorly reabsorbed in the small intestine. These undigested or unabsorbed nutrients from the small intestine enter the large intestine, where they have an osmotic effect. That osmotic effect pulls water out of circulation and into the intestinal lumen, resulting in large bowel diarrhea. Finally, we will briefly look at the consequences of diarrhea. The main consequence that we think of with diarrhea is dehydration. This occurs because fluid in the intestine that is not reabsorbed is lost to the environment. And remember, some of that fluid likely came from the body's circulation, not just what the animal drank or ate. This can lead to significant fluid volume loss per day, rapidly causing hypovolemia. That hypovolemia is then further compounded by the fact that the animal feels ill, meaning they are usually not drinking or eating appropriately to help counterbalance that excessive fluid loss. Depending on the type of diarrhea, electrolytes can be lost either due to active secretion into the intestinal lumen or due to inadequate absorption from ingested nutrients, preventing electrolyte replenishment. With diarrhea cases, we primarily see loss or lack of absorption of sodium, potassium, chloride, or bicarbonate. Bicarbonate loss is particularly significant as it results in metabolic acidosis. As I just mentioned, that bicarbonate loss can lead to metabolic acidosis. The body compensates for bicarbonate loss by retaining chloride in order to maintain the body's electroneutrality. In the absence of bicarbonate to help buffer that increased chloride, the relative hydrogen content of the bloodstream increases. This results in what we call metabolic acidosis. To help visualize this, we can put all of our cations, or positive charges, on one side of a graph, and then the anions, or negative charges, on the other side. They should be balanced to help maintain the body's electroneutrality. In diarrhea, we are losing significant amounts of bicarbonate, which decreases our anion levels. In order to compensate for this loss, the body then increases chloride retention. However, one of bicarbonate's main other roles is to buffer free hydrogen in the body. With bicarbonate being low in this case, there is inadequate buffering occurring. This results in increased free hydrogen in the bloodstream, which we call metabolic acidosis. To summarize, diarrhea can either be small or large bowel in origin. Small bowel diarrhea is due to some combination of secretory, malabsorptive, or effusive mechanisms. Clinically, we see it as infrequent passage of small amounts of fluid feces. Large bowel diarrhea usually occurs due to undigested or unabsorbed nutrients entering the large colon and disturbing the microflora. These nutrients have an osmotic effect, which draws water into the colonic lumen. Clinically, we see this as passage of frequent but small amounts of fluid feces. Regardless of the type or cause, diarrhea is significant because it can lead to dehydration, electrolyte loss, or metabolic acidosis. Thank you for watching PathoLogic. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there's also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.